Good day and welcome to the American Lung Association nationwide Coping with Lung Cancer Side Effects. Your presenters today will be Carly Ornstein and Dr. Cardinale B. Smith. Before we begin, we wanted to cover a few housekeeping items. At the bottom of your screen are multiple application widgets you can use. All of the boxes are resizable and movable, so feel free to move them around and get the most out of your desktop space. You can expand your slide area or maximize it to full screen by clicking on the arrows in the top right corner. If you have any questions during the webcast, you can submit them through the Q&A box. If you have any technical difficulties during the webinar, please let us know via the Q&A box. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in the background that could cause issues. The webcast is being streamed through your computer. For the best audio quality, please make sure your computer speakers or headset are turned on and the volume is up so you can hear the presenters. This webcast is being recorded and will be available one day after the webcast and can be accessed using the same audience link that was sent to you earlier. And now, to begin the webcast, I'll turn it over to Carly Ornstein. Please go ahead.
Thank you so much. Welcome to everyone. Welcome to our Coping with Lung Cancer Side Effects webinar. Thanks for joining us. This webinar is being recorded, as was mentioned, so if you miss anything, don't worry, you'll be able to go back and view the recording. And you can also submit your questions through the Q&A box. You can submit them at any time, but we'll be addressing as many as we can at the end of the presentation. Before we begin, I'd like to issue a special thanks to Health and Therapeutics for their generous support of this program. I'm Carly Ornstein. I'm the National Director of Lung Cancer Education at the American Lung Association, and I'm joined today by our speaker, Dr. Cardinale B. Smith. When we were planning this webinar, I was looking for a speaker, wondering who it should be, and my mind immediately went to Dr. Smith, and you'll probably see why. She really is a true expert in palliative care and coping with side effects. You might be wondering, well, what's the relationship between palliative care and side effects? Maybe you've never heard that word, palliative care, but Dr. Smith will cover all of that in her presentation. But first, I want to tell you a little bit about her. Cardinale B. Smith is an Associate Professor of Medicine in the Division of Hematology and Medical Oncology and the Brookdale Department of Geriatrics and Palliative Medicine at the Icahn School of Medicine at Mount Sinai, and the Director of Quality for Cancer Services, the Mount Sinai Health System. She's also a clinical investigator whose research interests include evaluating treatment disparities in cancer care, evaluating determinants of cancer patients' quality of care, characterizing barriers to optimal care and palliative care, and developing approaches to eliminating those barriers among racial and ethnic minorities. Dr. Smith is a 2013 recipient of a Mentor to Research Scholar grant from the American Cancer Society to evaluate determinants of disparities in the utilization of palliative care among patients with lung cancer. And additionally, she is the co-investigator on a Patient-Centered Outcomes Research Institute grant to teach and enable goals of care conversations among oncologists. Dr. Smith has had numerous publications in peer-reviewed journals, and she's the recipient of the 2014 American Academy of Hospice and Palliative Medicine Inspiring Hospice and Palliative Medicine Leader Under 40 Award. So clearly she is an expert, and I can't wait for her to start her presentation. So now I'm going to hand it over to you, Dr. Smith.
Great. Thank you so much, Carly. It is a pleasure to be here today and to be able to speak to all of you about something that is very important to me, and that's really improving the quality of life and quality of care for patients with lung cancer. In addition to being a palliative medicine physician, I am a lung cancer oncologist as well, and so this is something that's very important to me. What I hope to address with you today is what the role of palliative care is, what it is, why it's important, who it can help, and how you can get it, causes of the side effects that you can get from chemotherapy, reviewing common side effects and management tips, and then we'll take any questions that you have. So palliative care is specialized medical care for people with serious illness. It provides patients with relief from symptoms, pain, and stress of a serious illness, whatever the diagnosis. The goal of palliative care is to improve the quality of life for both patients and their families. Palliative care is provided by a team of doctors, nurses, and other specialists who work with the patient's other doctors to really provide an extra layer of support. It is appropriate at any age and any stage of a serious illness, and it can be given when someone is receiving curative intent therapy or if they're receiving disease-directed treatments with an aim of prolongation of life. I think often palliative care is thought of synonymously with hospice. The way I like to think of palliative care is that palliative care is really the big umbrella to which hospice is a portion of that when someone is really nearing the end of their life. But the rest of palliative care is for patients who are actively getting treatments while living life and trying to maintain the best quality of life they can, as well as that for their family. Palliative care is excellent evidence-based medical treatment. It is the vigorous care of pain and symptoms throughout an illness, recognizing that trajectory of someone's illness changes very much depending on where they are, and that you can have symptoms from the cancer itself as well as the treatments that you give. And it is care that's given at the same time as efforts to cure or prolong life. And so in that way, it is very different from hospice, which is really when the focus is on the end of life and there aren't disease, cancer-directed treatments that are being offered. The thing about palliative care that also sets it apart from other medical care is that it recognizes the whole patient. So it is not just the patient undergoing an illness, it is also their loved ones and their family, the caregivers who often bear a lot of responsibility for caring for that illness and who also have symptoms or have suffering related to the illness in the loved one. And so this slide is sort of this trajectory that I'm talking about, this seesaw that patients often tell me they're going throughout the trajectory of their cancer care. So that there are symptoms related to the cancer itself, there are symptoms related to the chemotherapy, and then there's everything else that one has to worry about, the psychosocial impact, depression, anxiety, things that physicians often overlook, not intentionally, but that often don't have a lot of training in managing. There are spiritual concerns. Certainly financial concerns are a big component, and really not just the caregiver themselves, but the patient worrying about the stress or the toll that this illness may be taking on their loved ones. So I wanted to start with just giving a big, broad, blanket overview of why we have some of the side effects that we have with the various treatment modalities that exist in lung cancer. Chemotherapy, which has up until now has really been the mainstay of treatment for lung cancer among others, is essentially medication that attempts to attack cells that are growing and dividing very quickly. Now, unfortunately, we have cells in our body that grow and divide very quickly that aren't cancer cells, but chemotherapy isn't specific. And so the parts of our body where we have cells that grow and divide very quickly most commonly are in our bone marrow, and that's where our white blood cell counts are made, our white blood cells are made, our red blood cells, and platelets. So you can often have low blood counts. We call that, neutropenia if your white blood cell count is low, or anemia if your red blood cell count is low. The cells in our GI tract, and that's all the way from the mouth, the lining of the mouth, all the way down to the anus, also are cells that are growing and dividing very quickly. And so that's when we run into side effects like sores in the mouth, nausea, vomiting, and diarrhea. And then, of course, our hair follicles are something that grow and divide very quickly. And so that's why some people can experience hair loss with chemotherapy. And then there are side effects that are specific to chemotherapy, which really depends on their mechanism of action. so that there are some medications that attack nerves, and that's why some people experience nerve pain or nerve-related injury, as an example. The next class of treatments that we use in lung cancer is immunotherapy. And cancer cells are smart in that they shut our immune system down. So that normally, for example, if we were to get an infection with a bacteria or a virus, our body's immune system would make cells to help fight that bacteria or that virus because our body recognizes it as foreign, that it shouldn't be there. Our immune system may recognize cancer cells as foreign and that they shouldn't be there, but the cancer cells have really learned to turn that system off so that our immune system can't work for us. Immunotherapy is now a way that can try and overcome that and activate our immune system so that our immune system can help fight the cancer cells. Unfortunately, you can get an overreaction of our immune system, and that's really where we start to run into many of the side effects that are associated with immunotherapy. So places where we tend to have more immune cells get overactivated, and that includes the lungs. So we get an inflammation of the lungs, which may be manifested by worsening or new shortness of breath. It can affect our endocrine system, specifically the thyroid, and often patients may experience fatigue, but most commonly we see the abnormalities in the blood work, which is why patients get their thyroid numbers checked very regularly on this treatment. It can affect our GI system. Mostly that's manifested as diarrhea. It can cause an inflammation of the liver. And often people don't have symptoms associated with that, but we do see it come up in abnormalities of the blood. And then finally, one of the common things we see is in the skin, so that you can get a rash or itchiness. And then really the last big group of treatment that we have for lung cancer is targeted therapy. And there are several agents that we have available that target specific receptors that are associated with helping cancer cells grow. And although those receptors are on cancer cells, you can also have some of these receptors on normal non-cancer cells in our body. So for example, when we talk about the EGFR receptors, the EGFR receptors are on our skin and in our GI tract. So one of the side effects you can get with this class of medications is rash, diarrhea. You can get hair loss or you can get hair thickening, depending on where in the body the hair is. Now we'll go through some of the most common side effects that's experienced with someone with lung cancer. And so nausea is really related to treatment effects on the cells of the GI tract. We often divide chemotherapy into how likely it is to cause, well, not just chemotherapy, but all treatment, into how likely it is to cause nausea and or vomiting. So we think of these categories as low risk for nausea and vomiting, intermediate risk, or high risk. We have standard algorithms that we use to give patients medications both before they receive the treatment in an effort to prevent the development of nausea and vomiting, medications that we send patients home with to take to prevent nausea and vomiting, and then medications to have on hand at home should nausea and vomiting develop. And so for patients receiving high-risk chemotherapy or intermediate-risk chemotherapy, it is important to get medications prior to chemotherapy, take them at home to prevent nausea and vomiting. We call that prophylaxis, to prevent the nausea and vomiting from developing, and then have medications at home should the nausea and vomiting develop. For low-risk chemotherapy, targeted agents and immunotherapy fall into the low-risk category often because they don't have a high risk for nausea and vomiting, although it does happen. And the way we treat that is really to have medications at home. And I would say that we have multiple classes of medications that can really treat nausea and vomiting. And it is important to know that there are different ways in which these drugs can be administered. So if you're feeling nauseous, it might be difficult to swallow a pill. And so there are different formulations for many of these medications in that they come in the liquid form, they come as an oral disintegrating tablet, so something that you can put under your tongue and it disintegrates with your saliva. There are films, so little plastic-like sheets that you can put on your tongue that similarly dissolve. And then, of course, should the nausea and vomiting be so severe that it's really hard for you to keep anything down, then there are intravenous forms, so liquid medications that we put in through the vein. Non-pharmacologic ways to really try and treat nausea and vomiting includes really trying to avoid stimuli that's noxious, so, smells. We all know those people who wear really strong perfume sometimes, who use really strong soaps, and so trying to buy mild, non-perfumed soaps for yourself or detergents, for example, or staying away from restaurants that may have really strong odors are some of the things that can be helpful. And then it's also important, in as much as you can, to stay hydrated, really to drink fluids, including water and other fluids with electrolytes. The next side effect we'll talk about are mouth sores and dry mouth. So this is much more common with chemotherapy, although it certainly can happen with some of the oral targeted medications that we have. The most important thing you can do is really good dental care. And so one of the things that I make sure to do is, while I'm not a dentist, I certainly look and examine someone's mouth. And before starting treatment, and if I see that, there may be some cavities that haven't been treated, or if the patient hasn't been to the dentist in a while, I certainly suggest that they go get a thorough teeth cleaning before we start, really to minimize any potential complications during treatment. And then good dental care, making sure that you're flossing, that you're brushing your teeth, and rinsing with bland rinses. If you do develop mouth sores, or if they're very mild, really gargling with water and baking soda is something that's often very helpful. If you do get it, it is important that you let your doctor know. Sometimes you can have a fungal infection, something that we call thrush, that's superimposed on top of your mouth sores, and that can make the mouth sores feel worse, and there are medications that we use to treat that. And then if you're experiencing pain or discomfort, there are mouth rinses, mouth washes that one can get that you either swish and spit or swish and swallow to help with some of the pain and discomfort. And depending on the severity, sometimes we may need to hold the treatment until those symptoms improve. For dry mouth, some things that can be really helpful is sucking on sour candies. I know patients who like to suck on ice chips frequently, particularly during chemotherapy infusions. We know for some chemotherapy, although not chemotherapy that we commonly use in lung cancer, actually the more you suck on ice chips during the treatment, the less likely you are to experience mouth sores. But that can be hard to constantly keep ice in your mouth. Skin issues are really common both with chemotherapy agents as well as our oral agents, and we're starting to learn more about this in immunotherapy, that it is not as uncommon as we once thought it was. The most important thing is really prevention. So purchasing a really good moisturizing skin creams. Sometimes samples of the oral agents actually come with some of the skin creams that you can try. And you really have to slather it on and use it very generously after every bath or shower, and certainly at least twice a day. That's really the best thing you can do to prevent the dry skin that can develop and some of the splitting and the fissures that you can get in your skin. It's also important when you're on these treatments to avoid direct skin exposure. These treatments sensitize the skin so that if you're in direct sunlight or direct UV rays, your skin is much more likely to burn and experience the side effects associated with direct sun exposure compared to someone who is not on these treatments. And so it's important to use sunblock and protective clothing. It doesn't mean you can't enjoy yourself and go out to the beach or vacation somewhere where there may be lots of sun, but you just have to be smart about it and make sure that you use sunblock frequently, that you're in a shaded area. Scalp sores can be related to many things. It can be ingrown hairs or infections, something that we call a folliculitis. So if you're noticing it, commonly physicians aren't evaluating or examining your scalp during your visits. And so if you're feeling uncomfortable or if you're noticing something different, it's important to mention it to your physician because sometimes we can give creams, steroid creams, for example, that can help decrease that inflammation. And there are other things we can use depending on what the etiology is, what the source is of the scalp sores. And although I know this can be hard, I think it's really prudent to just, and as best as you can, try to avoid nail salons. The risk of fungal infections are certainly increased at nail salons. If it is important for you to go to one, then certainly going to one that you've gone to before, that you've had experience with, where you use, bring in your own equipment that's clean and sterilized, is certainly something that we recommend because getting a superimposed fungal infection, particularly on the nails, can be very, very challenging. And then for those who undergo surgery or invasive biopsies, for example, soreness is something at the incision site is something that is quite common. And I think people are often unprepared for how long you can experience it. So one of the things I like to say is that, unfortunately when nerves are cut, they can't really regrow or regenerate well. That's why when we have a spinal cord injury, for example, often people are paralyzed as a result of that because those nerves can't really ever grow back. And so during surgery, it is inevitable that nerves are cut. And when that happens, people experience the results of that in different ways depending on where and what kind of incision they've had. And so most commonly it's described as a burning, numbness, tingling, a discomfort, or really a tenderness whenever clothes touch the area. Often women may say, like, I can't even wear a bra over it, it's so uncomfortable. Others may say something like, like even when my shirt touches that area, I get this really uncomfortable feeling, and that's really related to the nerve. It is something that can last for many, many months and sometimes never goes away completely. You may always experience some level of numbness or discomfort in that area. It often certainly does improve, but again, can take months to a year to do so. If that area, that incision, is actually painful, there are medications that can be used to help with the nerve pain, and so it would be important to talk to your doctor about that. And then chemo brain. So chemo brain has many different names. We attribute it to chemotherapy. It certainly can be related to cancer itself in the absence of chemotherapy. It can be related to radiation treatment to the brain as well. And it can be quite debilitating. Patients often describe it as a mental cloudiness, and the severity can vary very, very significantly. And the timeline can also be very different. Often patients may say that they forget things that they usually have no trouble recalling, so they have memory lapses. They may space out because they can't concentrate as much. Remembering small details, particularly your short-term memory, gets very taxed. And multitasking can become very difficult. This is obviously something that impairs quality of life pretty significantly, and can cause, and you can get into this vicious cycle because you recognize that you may have some difficulties doing these tasks. That builds up anxiety, you get stressed about it, and then that just sort of makes it worse. And so it can be a vicious cycle. From a medical standpoint, it's really important for us to rule out other causes of some of this mental cloudiness, and often that is underlying undiagnosed depression, anxiety. Sometimes you can get cognitive impairment related to age. So, for example, dementia is something that can be contributing, and there are ways in which and tests that one can do to determine what may be causing this. Chemo brain is what we call a diagnosis of exclusion. So that means that we've looked for other potential reversible causes, and we have nothing left that we can say is contributing to it, and so it falls to this diagnosis. Things that you can do, as much as you can exercise your brain, it's really been shown to be one of the better modalities. Unfortunately, although there's a lot of work going into this area trying to study pharmacologic or drug-based treatments, we really don't have any concrete way to make this better as of yet, but we do have things that you can do to prevent the severity of it or to slow it down. And so doing word puzzles, reading, which can be hard because of the concentration, but in as much as you can do those things, it's helpful. Really using a planner and organizing your day, making sure to write things down so you don't forget it. Really having a plan for, when I come in the house, all the time I will put my keys in this one particular spot so that it becomes sort of rote memory and more challenging for you to forget it. Focusing on one thing at a time and really recognizing that, it's not your fault and that sometimes everyone may need a little bit of help, and asking for help certainly is something that is okay to do and that you probably need to give yourself a little permission for as well. Depression and anxiety, as I've mentioned before, is something that is pretty common but underdiagnosed and undertreated, especially in cancer. We have lots of work in this effort in trying to improve our screening for depression, and so hopefully this is something that will be recognized and treated more often. There are non-medication-related approaches to treating this, as well as medication-related approaches. Psychotherapy, there are really great evidence-based methods for cognitive behavioral therapy and other such things that can really help someone deal with the coping. It's really often situational in dealing with the diagnosis and the impact that has and the toll that it takes on your life. Mindfulness and meditation is something that's been shown to really mitigate the effects of depression and anxiety. Massage, because quite honestly, who doesn't love a massage? That can really help with some of the feelings that someone may have. And then there are concrete coping skills that can be taught to help you overcome some of the situational depression or anxiety that you may be feeling. There are, of course, medications that can be used for depression and anxiety, and I would say, the one thing is that often I hear, well, I don't want to start something and then be on it indefinitely, and I would say that that's not necessarily the case. Sometimes people need to take it while they're getting through a hardship, of starting treatment or have heard, bad news, and really need to just take it for a short period of time until they learn all of these other coping skills and mechanisms to help them get over it. Some people need it for longer term, and that's okay as well. The one caveat is that it can take weeks up to a month for any antidepressant to really take effect. And so if you feel like you're struggling or if you're feeling sad, it's important to bring that up to your doctor sooner rather than later. Shortness of breath and cough are two very common side effects associated with lung cancer. And it can be related to the cancer itself, so you can develop a fluid in the lungs, which medically we call an effusion. The cancer in the lung itself can block airways, and that can make it difficult to breathe. It can irritate the lung and can cause a cough. Or you can have a blood clot in the lung. Really, cancer itself makes our blood thicker, and so puts someone at an increased risk for developing blood clots. Shortness of breath and cough shortness of breath can be related to the treatment itself. We talked about in prior slides how chemotherapy, targeted therapy, and immunotherapy all can cause an inflammation of the lung, which medically we call pneumonitis, and so that's manifested as shortness of breath. And then surgery itself. So if you're removing a portion of your lung, that certainly can leave you with shortness of breath in the short period after the procedure. And that's primarily because the body has to now learn to deal with that portion, to do the work of that portion of the lung that has been removed. I would say for most patients, depending on how fit you were at the time of surgery, the shortness of breath gets better within months. For others, it takes longer. There are some, like not physical therapy, but some respiratory therapy type treatments, rehab that you can get to help to teach you how to breathe, to help you learn how to minimize your effort and conserve oxygen so that you don't feel a short of breath. It's important to rule out a medical cause of shortness of breath if none of these things exist. And so we talked about a fluid in the lungs, and so often we can diagnose that really on exam. You can hear fluid on the lungs. You can get an X-ray or a CAT scan, for example. Fluid can potentially be drained, and there are many ways in which one can drain a fluid. But if your shortness of breath is related to a buildup of fluid, often draining it can be helpful. If you have a blockage of an airway from the cancer itself, there are multiple types of local therapy that can be given. So, for example, radiation that attempts to shrink the cancer causing the blockage to open up your airways and help your breathing improve. Also bronchoscopy, which is where the lung doctors put a camera with a long tube down into your airways. I sort of call it sometimes rotor-rooter surgery because they can cut out some of the tumor, the cancer that may be blocking the airway, or they could put in a stent to try and open up that airway to relieve the blockage. For pneumonitis, which is that inflammation of the lung that leads to shortness of breath, often we treat that with steroids because steroids are a good anti-inflammatory agent, and then holding the treatment that's causing the pneumonitis, which can be any of these categories of treatment, including radiation. The duration of the steroid treatment varies, and we usually start at a high dose and then come down slowly over time and watch your symptoms and decrease the steroids as your shortness of breath improves. For some people, that can be short over the course of days to weeks. For others, it may take much longer. And then finally, to manage a blood clot, we give blood thinners, and blood thinners can be given as oral pills or as injections. Other methods for treating shortness of breath include oxygen. So we know oxygen works the best if someone's oxygen level is low. And so that means a normal oxygen level is somewhere in the 90s, 92, 93 or above, depending on some of your other medical problems. And if it goes under 88%, while you're walking around, then that is an indication to get oxygen therapy at home. And then opioids, which are pain medications, decrease the sensation of shortness of breath, and so they can be very effective in low doses at helping with shortness of breath. Having a fan blow in your face and as much as you can also help with that feeling of shortness of breath. And similar to the treatment of nausea and vomiting, avoiding smells that can make it difficult for you to take deep breaths can also be helpful. And then for cough, there are a multitude of anti-cough agents that exist, and they run the gamut anywhere from over-the-counter medications that you can buy at your local pharmacy to prescription-strength medications, and include pain-like medications in lower doses, again, that prevent that cough reflex. And cough happens in patients with lung cancer for many reasons. One can be related to the cancer itself, so that the cancer is pushing on an airway, causing irritation, and contributing to the cough. If you have fluid on the lungs, for example, the lung, when it tries to expand, can't expand all of the way, and that can lead to cough. And then for patients who were smokers, and who maybe quit right at the time of treatment, those lung cells, they start to open back up again, and that can contribute to the cough. And so finally, I want to say that, and I think I can safely say this as an oncologist as well, is that you're never a bother. Certainly, if you have any concerns, any new symptoms that are urgently impacting your quality of life, that are new and bothersome, you should reach out to your oncologist. Often there's, a cheat sheet of all of the things you should call an oncologist for that are emergencies, but sometimes you may have a new pain and you're not really sure what to make of it, and you can call with those concerns. Side effects are common. If they can be from the cancer itself or its treatments. I think we try to do a good job at preparing because, sort of prevention is key for many of these side effects. But sometimes there are rare side effects that are associated with medications that we don't see commonly, that we don't that we can't predict ahead of time, that can happen. And even though they're often not common, if it happens to you, it's clearly something that's stressful and important. And so it is always really important to bring up any new issues to your doctor. And then finally, palliative care or supportive oncology is another phrase that you may see, can be really helpful in helping improve your quality of life and managing the side effects associated with illness. And so if you feel like you could benefit, if you're having multiple symptoms, then you should reach out to your oncologist and ask for how you can get this type of a resource.
Great. Thank you so much, Dr. Smith. That was a lot of great information. I definitely learned a lot, and I hope everyone on the phone did too. So now we're going to answer some questions. You can ask your question using the Q&A box at the bottom of your screen, and we'll try and get through as many as we can. So the first question I have comes from someone on the webinar who said that their vocal cords were damaged due to radiation treatment. Is there anything that can be done to repair this?
That's a great question. So perhaps I would say the best thing to do is to see an ear, nose, and throat doctor. They have the ability to take a camera and look at your vocal cords, and they'll have you do things like say ah and other such things that they can get a sense of, how significantly paralyzed or damaged your vocal cords may be. And there are local treatments that they can do to help you with that and to help get your voice back. But it really depends on what's causing that.
Thanks so much. What are the consequences of drinking alcohol while taking a targeted agent like maybe Tarceva?
Yes. So I think as doctors or people in the medical field, we're trained to say no alcohol with medications. I think that anything with moderation. So if you're having a glass of wine a couple of times a week, there are no significant complications associated with that. But certainly you shouldn't be drinking alcohol daily.
Great. Do you have any thoughts on nocturnal leg cramps in the calves?
Oh.
This person is on a targeted agent as well.
Yeah. So that can be due to multiple things. I would say one of the things to do is really to look at your lab work, your electrolytes, so things like calcium and potassium. When they are low, you can develop leg cramps, and often, you maybe eat a banana, get some infusion of potassium or get some calcium, and that can help with that. That would be where I would start first. Also, if your magnesium level is low, you can also experience leg cramps. It would be important to know these are leg cramps just at night. And so I would start there first.
Great. What about high blood pressure as a side effect?
Yeah, so there are some of the targeted medications that can increase your blood pressure, and it's not a manifestation of anything that you may have done, like eating something too salty, etc. It really is just that some of the targeted agents work specifically on blood vessels, and so it increases your blood pressure. And so one of the things that we often have to do is treat the high blood pressure with medications, with high blood pressure medications to be able to lower the blood pressure.
Thanks. This is a question about testing for oxygen levels. Someone from our helpline said that they had a caller that asked if the testing had changed. Do you use a finger probe versus a head probe, and it offers different results? Do you have any thoughts on that?
So it all depends, I would say, on the machine you use. I think in general we think that the finger probe gives you a better answer, and so that's what we commonly use. Sometimes it can be hard to pick up the oxygen levels from a finger probe, so sometimes we put it on the earlobe or we put it on the forehead, but to my knowledge, the finger is still the best way to get a reading.
Thanks. Question from someone that's undergoing targeted therapy. She says, how can I force myself to eat and gain weight when I have very little appetite? And I'm sure that many people have this question.
Yeah, that's a great question, and it can be hard to manage. So we call that anorexia, which is just medically a lack of appetite. And often I say, eat what you can. There are lots of people who come to me talking about things like juicing or avoiding sugar or avoiding red meat. And I would say that to the best of our knowledge, we don't have any information so far that, sugar, red meat, or those things increase or worsen your outcomes in terms of cancer. And so it's important that you eat foods that are calorie dense and that have high amounts of protein in it. And so the thing that I start off with always is that, there are protein powder packets that you can buy at your local, like Pharmacy, GNC, et cetera, these sorts of nutrition type stores. And because they're so small, you can sprinkle them on like applesauce, and you can eat a little bit of applesauce and you're getting immediately increased calories and increased protein. So that's one, is that you have to try and do it. Second is that there are medications that you can try to stimulate your appetite, and these are prescription medications. They don't work 100%, but when they work well in terms of stimulating the appetite. The problem is that they don't also cause weight gain. So they may cause you to eat more, but that doesn't necessarily translate into weight gain. And I would say, I know another thing that comes up for those folks who are in states where medicinal marijuana is legal, that this is a treatment that is often also talked about. We don't really have great information on the role of medicinal marijuana and how it works for patients. And so in New York State, for example, where I am, one of the indications for the use of medicinal marijuana is a patient with cancer who not only has weight loss, but has muscle loss as well associated with that weight loss. And, people say that it may stimulate their appetite, but it doesn't always translate into weight gain. And so it's often not something that I can recommend. So I say try and stick to eating what you can, but making it as calorically dense as you can with increased protein. And then you can try some of these over-the-counter medications, some of these prescription medications that may be helpful.
Thanks. Can you talk a little bit about why it's so important to maintain your weight?
Yeah, so we know that regardless of stage, that patients who have more weight loss tend to have worse outcomes across the board, both in terms of survival as well as quality of life. And so in as much as you can try to prevent weight gain, it is important, but recognizing that it's hard. And so there's this balance between not trying to, torture yourself or feel as if you're not doing the best you can because you can't maintain your weight, while still trying to do the things that you can do to maintain it.
Thanks. That's helpful. Is there any way for a caregiver to tell at home without having the patient go for a CT scan or an X-ray if the patient's cough is the cancer progressing or if it's a side effect from the medicine?
That's a really good question. And unfortunately, no, there's no good way to tell which may be causing the cough, particularly because the cough could be related not just to the cancer itself, but also, you could be developing a new issue. So I didn't talk about this, but pneumonia, for example, bronchitis, infections in the lung can also contribute to cough. The development of fluid in the lung can contribute to cough, or the cancer itself could be getting worse, and that could contribute to the cough. And really the only way to know that is by doing an exam, listening to someone, and then doing some sort of test like a chest X-ray or a CAT scan, depending on the findings.
Thanks. Can you address some of the longer-term potential side effects? This person said that 4 years after diagnosis and survival, they developed heart failure, peripheral neuropathy, and an inner ear issue.
Yeah, so we didn't address peripheral neuropathy in this talk, but it is certainly a common side effect, and it is one that you can experience both during treatment, or if treatment has stopped, you can develop it later. It's usually one of those things that should go away with time, but for a small amount of people, it is permanent. And that can manifest itself in many ways. So it can be anything from numbness or tingling in the hands and the feet to having difficulties opening jars, buttoning your clothes, doing zippers. And so it can have very varied impact on quality of life. Unfortunately, there's no way, if this is years later and you still are experiencing neuropathy, it is unlikely that it will go away. And there's, outside of medications for the pain, so the tingling or burning sensation that you can experience with neuropathy, there aren't great medications to treat it. The best thing to do is really physical therapy because it can help with your strength, it can help with grip, and potentially even occupational therapy, which can sort of help you learn how to do things around your home environment that can compensate for some of the deficiencies you have from the neuropathy. There are other long-term issues. You mentioned an inner ear issue. I'm not sure if that's like dizziness associated with vertigo, which is also related to the nerves, to damage to the nerves. There's hearing loss associated with some of the chemotherapy medications that can be long-term. And I keep saying chemotherapy, but this can be attributed to targeted therapy. And now we're learning much more about immunotherapy as well. And so that's why it's important to have either a long-term relationship with your oncologist or to have a primary care doctor who is in touch with your oncologist to get a sense of what of these things are related to long-term effects of treatment versus the development of new problems, right? Because neuropathy is certainly something that can happen from these treatments, but it's also something that can happen with somebody with diabetes or HIV. And so it is important to, have some medical person evaluating you.
Great. Okay, I think those are all of our questions about side effects. Thank you so much for coming, everyone. I wanted to thank Helsam Therapeutics again for their support of this program, and also Dr. Smith for her wonderful presentation and her time. And just to encourage everyone to do two things. One is that each one of you will receive an email with a link to a very brief survey evaluation. So it's really important that you take that and let us know what your thoughts were. That way we can target our future presentations to better meet your needs. And also, we have a variety of resources on lung.org. Lung.org/lung cancer will take you to all of our lung cancer resources. And two other resources I did want to call out, and these will also be in the email that you're going to get, is our lung helpline, which is staffed by health professionals like registered nurses, respiratory therapists, and they can be very helpful in answering any questions you might have. Their number is 1-800-LUNG-USA, and again, that will be in the email. And lastly, we have a large support community on the Inspire network. Lung.org/community will get you there. It's called the Lung Cancer Survivors Group, and there are a lot of people on there that are living with side effects, firsthand, and they have some good tips. So, of course, always talk to your doctor first. Don't do anything without discussing with your doctor, but also other lung cancer patients can be great resources of information. And again, all of that will be sent to you in an email. So thank you again for joining, and I hope you have a wonderful day.
And this will conclude today's program. We thank you for your participation. You may now disconnect and have a great day.